allergy and asthma, what has been the experience in where you're practicing presently and your study about India?
Yes. So just to give some background information, so I actually was born and raised in Canada, and for the last 15 years I've been practicing allergy immunology in the United States, in Nebraska. And in the U.S., this field of allergy immunology is well established. It has been for a number of years, and we treat both children and adults. The Western world also has a very high sensitization rate. So a lot of atopic disorders. We see a lot of asthma, allergic rhinitis, atopic eczema, chronic urticaria, chronic sinusitis. And for a long time, the misconception was that allergic disorders only exist in the West. They don't occur in developing countries such as India, and that is absolutely false. So for the last 10 years, I have joined Dr. P.K. Vedantan. I have joined him at some asthma camps in India where I've had real-world experience treating asthmatics. I've also joined him in his endeavor at Christian Medical College in teaching postgraduate doctors about the basics of allergy and immunology. And so really we see the same disorders, the same prevalence rates. About 25% of the Indian population, for example, is sensitized to dust mite, and many of them, about 10% of them will go on to develop asthma. So these are the same struggles that we have struggled with in the West. And so I think it is critically important to educate as many physicians as possible, to raise awareness among physicians, but also among community members. Allergic disorders are not benign. They do have, they're associated with significant cost and can have a significant impact on quality of life. And so our focus in this program is really to especially train the pediatricians. These are the doctors who will be seeing these children firsthand. And so it's important that they be equipped to recognize and intervene early in life in order to treat these disorders. There's actually a window of opportunity. If you have a child who is sensitized but does not have asthma, if you intervene, for example, with allergen immunotherapy, there's a good chance you can actually prevent the development of asthma. So these are some critical issues that I think we need to address.
What is the typical change of perspective that you see in the West and in Indian conditions, where one, as you have rightly said, that the understanding is not as clear or it's not as wide and varied. At the same time, the response coming from the patient and their guardians are not forthcoming.
So I think for a long time in India, the field of allergy itself wasn't very well known, oftentimes not taken seriously, oftentimes thought of as just a lifestyle issue, something that you live with, it's a mere nuisance. But I think what people are finding out right now is no, it's not. It's more than a mere nuisance. There are a lot of consequences. People are actually dying from asthma, for example. People are dying from anaphylaxis that is not being recognized. So I think we need, and it is playing a more and more prominent role. For example, today in India, asthma and COPD collectively, I think is the second most common cause of death in India. So obviously, the landscape of medicine has changed in India. We're seeing less and less communicable diseases. We're seeing more disorder associated with lifestyle issues, such as allergy, asthma. Just like we have prevalence of diabetes is going up, prevalence of coronary artery disease, autoimmune disorders, inflammatory disorders. All of these things are going up and are affecting the population, and especially as the population lives longer, more and more people are being affected.
What has been your experience about talking to with this two course coming for the postgrad or master's student or the doctors? And earlier it was more into the beginning of the course.
Yes.
So there is a stark difference. Do you feel that the people here have some more understanding about the subject or the course or the case than in the West, or is it just the other way around?
So, for example, for the last 10 years, I've been involved in the course at Christian Medical College. These are all postgraduate physicians who are coming specifically to learn more about allergy, immunology. And, there is a great interest. I think people, the Indian physicians are very, very, very smart, very qualified. They have this curiosity. And, but there is a paucity of programs. There's a paucity of educational programs specifically for allergy and immunology. So oftentimes the content that they receive, it may not be pertinent to India. A lot of the things that we discuss, a lot of the data that we go over, often is Western data. It may not correspond to the reality here, and so this, and this initiative here today is really the first pediatric program as such, the first Pediatric Allergy Asthma Diploma course, specifically focused on pediatricians. They see people much younger on the spectrum. They're dealing with children, and so there's actually more potential to intervene. Oftentimes with chronic disorders, allergic disorders, if you wait too late, there's not much you can do really other than symptomatic treatment. You can't really change the disease through disease modification. So what we're trying to achieve here is really, and these students, today's just the first day, but I've been very impressed by the questions that they ask, their curiosity, their interaction. I think definitely there are people here who really want to be on the forefront and who have a really dedication to making a change, especially among the young, among children, to prevent, burden of disease for the next 40, 50, 60, 70, 80 years. And so I think they're asking the right questions. Hopefully with this program, with this curriculum that we have set up, which include, faculty from not only from the United States, but from India, we got faculty from UK, faculty from Singapore. We are hopeful that we will be able to give them a comprehensive curriculum where they can address some of these questions. And at the same time, we also want to train these people not only for their own practice, but we want to raise up physicians who can then train others and really develop the specialty of allergy and immunology here in India.
One last question would be, would you be able to divide all the four modules, all the four segments that you are running over the year? What is the part of the course that you're teaching? If you can talk a little bit more on the public interest kind of thing rather than a more medical terms.
So I think in terms of public interest, the first section is just an introductory section. So we try to teach basics, concepts of allergy, immunology. We try to teach basic concepts of, what is allergies, what is asthma, what are some of the tests that we use, what is skin testing, for example, what is lung function, so when you want to measure someone's lung function with spirometry, what does that entail? So these are basic things. We teach the basic terminology. So what is allergy, what is atropy, what is immune deficiency, so things that may not be common in the jargon, medical jargon here. So these are introductory principles that we try to address. We also have assignments that we try to give so that when physicians go back, they can touch up on these points. And we also have some hands-on workshops. So it's not just theory, but also practice. So we demonstrate skin testing, we demonstrate spirometry, we demonstrate what's called impulse oscillometry. So these are things that we do in the first section, and then in substance sections. And these things are a little bit fluid because this is really the first time that we're doing it. But in the substance sections, we will address other topics like drug allergies, for example. We will address immunotherapy, which is really the bread and butter of our specialty. We will deal with primary immune deficiency disorders. And in the last section, I think we'll deal more with just clinical cases, perhaps more focused towards, what we typically see here in India. And we finish with an exam that is not only theoretical, but there's also a practical aspect to the exam, where candidates have to demonstrate that what they've learned they can apply in a real world way that can be applicable. So hopefully these are all things that we're hoping to achieve in this 4-module program.
One more question that if I may take a chance. A World Health Organization says that diabetes worldwide is turning more on epidemic side than anything else. Where do you place this allergy and asthma development in relation to the developing world in Asia and Africa?
Yeah, so I think where we're seeing the most growth, the most rise in atopic disorders is really in developing countries such as India and other countries in Southeast Asia. For example, if we just look at the Western world, there's been a 3-fold increase in the last 3 decades in the prevalence of allergic disorders. Allergic rhinitis, asthma, atopic eczema, food allergies. These things have really gone up in the last 3 decades and now are plateauing. But yet here in the developing countries such as India, we are also seeing a rise. And I think that has to do with modification in lifestyle. That has to do with more urbanizations. It also has to do with just increased sensitizations in general. And so I think we see that already the same sort of pattern, that these disorders are rising. And actually, they're probably rising faster than in the Western countries. So definitely there's an epidemic. Definitely we need to address it more aggressively by raising awareness, by training graduates to tackle these problems. Otherwise, as I mentioned, even today, forget about the future, even today, asthma and COPD combined are responsible for it is the second leading cause of death in India. So there's already an epidemic here. I think we need to address it. India also poses certain challenges like air pollution. I think that also contributes to the morbidity, mortality that we see here. So these things have to be addressed. We need to make it a priority, and at least I'm actually feel honored that I can play a small role in this process.
Thank you very much and all the best. So I'm sorry I kept you waiting.